Hello everyone, welcome back to our YouTube channel. This is Nikki from team Gyanshetra. So today in this video, I would be discussing about the new FMG rule which was placed on the NMC website on 23rd of April. So a lot of you must be confused that why am I making the video so late. तो सबसे पहली बात ये है कि from the past 15-20 days we have been receiving a lot of calls from the students, from the FMG candidates as well as students who are planning to go abroad for their MBBS education. So there has been a lot of confusion regarding the same whether the new act which has come into place will that create a hurdle for the FMG students. So there has been a lot of confusion in terms of what has been written in the draft. First of all, the FMG new guidelines which has come out in the NMC website, it is still a draft. It has not yet been officially enacted as an act. It is still not an ordinance. It is still not passed in the official gadget. So in today's video, I would be discussing with you about what is exactly written up over there and क्यों बहुत सारे स्टूडेंट्स कंफ्यूज हो जा रहे हैं विद द रूल्स एंड रेगुलेशन दो these are the understanding what our team has. Maybe if we want to be more clear, you student can put the same with the NMC, ask them with concrete guidelines as to whether it applies to you or not. So coming to the first and foremost part, which is the eligibility criteria for the students who want to practice in India. Over there in the section 3.1 is for students who have done their +2 from India. It's for students who have done their 11th and 12th from India and then they are planning to go abroad to pursue the medical education, right? So in that it's very clearly written that the rules, the eligibility for taking admission abroad, it's same as what the eligibility criteria is there in the NEET PG entrance exam. Firstly, they have asked that there should be 12 years of schooling, which is mandatory, and it should be from the state recognized body or CBSE or ICSE bodies. Second, it states that you need to qualify it with the minimum percentage marks, which is always introduced or which is already being mentioned in the prospectus once the NEET application forms are up. Generally, it is 50% for the general candidates. Third criteria is they have asked that you should have studied physics, chemistry and biology or biotechnology as your core subject. Now, the very important point over here is still there's a court case going on where it still allows students who does not have biology as the core subject, they are being allowed to give the NEET UG entrance exam. So still this thing has to be cleared. Also, why this thing has to be cleared from the NMC, because there were students who are already studying in foreign universities or who are already pass out. These students might not have biology as the core subject, or it could have been an additional subject for them. So the third point, which is very concretely written over here, that you should have PC and B, that is biology or biotechnology as your core subject. Still there is no mention of students who are exempted till now, because the case is still going on in the High Court and MCI has already taken a pause in the case via Supreme Court. An appeal was filed last year also. So we have to be very clear for the same. Fourthly, they have said that NEET is the eligibility criteria if you're planning to go abroad. So it was already passed in the year 2018 that NEET would be the eligibility criteria for going abroad. So it's very much clear that it should be there, but you need to be very clear for the students who have gone prior to 2018 and 2018 and prior to 2018 who are planning to come to India again. So for students who have done MBBS from abroad but have completed their 11th and 12th from India, for them this section 3.2 becomes very important. Now there's one more section which is 3.3. Guys, this is not for students who have done 11th and 12th from India. Please don't get confused regarding the same. 3.3 clearly states that it's for those students who have done their senior secondary as well as MBBS from abroad. So it's not for students who have completed 11th and 12th from India and then they have gone abroad to pursue their foreign medical degree. Yes, they have brought in certain changes or they have very concretely written about students who have done their 12th from abroad and done their medical education from abroad. What is the conditions which are required from them if they plan to come to India for practicing? So they have clearly written that they should be studying physics, chemistry, biology or biotechnology and English as the core subject. Or if they are doing graduation, so in the first year itself, they should be doing their physics, chemistry and biology as the core subject, as well as practicals should also have been taken for them, and the entire education should be in English. The second criteria which they have given is there should be 54 or 4.5 years, 54 months or 4.5 years of your medical education, plus 12 months of rotational training, or you can say it's a clinical rotation or clerkship, which is called in a lot of countries. So you should be having your 54 months of education in MBBS plus 12 months of compulsory rotation. This is very common in India, so they have just included the same criteria over here also. Now, the point C clearly states that people who have done their graduation and post-graduation, they are entering into the MBBS education, they need at least a minimum 48 months or 4 years of your education in MBBS plus 12 months of your clerkship or clinical rotation should be there. So these are two conditions. One is for people who have done MBBS after 12. So for them it's 54 months. And for people who have done their MBBS after graduation, because there are few countries where MBBS is only done after graduation, for them it is 48 months. Now coming to the another criteria which they have given for, these are completely for those students guys who have done their 11th and 12th plus MBBS from abroad and they want to come back to India for the practice purpose. Now another criteria they have said that you should be having the basic medical education, that is your theory practical plus rotational training should be same as that happens in India. The rotation training should be same as that happens in India. It should be hands-on clinical training and they have clearly mentioned the subjects where you should be clinically posted like dermatology, psychiatry, medicine, peds, etc. So that should be the same part. Moving to the second question, moving to the second part, they have clearly mentioned that you should be completing your medical education from the same university where you have completed, you should be completing your medical education from the same university where you have started. That is, your medical education plus your 12 months of internship should be from the same university. You should not take any transfer or something like that. And the last point which states that your degree should be registered or you should be licensed to practice in the same country where you have obtained your medical education, medical degree, plus that license should be very much valid for at least 10 years. So now there has been a lot of confusions where it's going on that transfer is not allowed and how is it possible that people, that we Indians, if we are studying abroad, will be allowed to to get license in the same country where we are studying for at least 10 years. Now guys, this is absolutely not for you guys who have done their 11th and 12th from India and they are going to pursue it from outside India, the medical degree from outside India. This criteria, these all criteria which I have talked to you about regarding the license to practice, also to say about rotational trainings and everything is for students who have completed their 11th and 12th plus people who have done their MBBS from abroad. These criteria are solely for them. Now, if there is so much of a confusion whether that applies to Indian students who are going after their 12th or not, guys, you should directly pinpoint these questions to the NMC directly. It's still a draft, so things would be very much clear. But as far as my knowledge and our team's understanding, it is not for you. So guys, please don't get panicked that transfer is not allowed or something like that. If you have any doubt regarding it, kindly speak to the concerned kindly put yourself to the NMC directly and they would clear it out. Now coming to the most important aspect, which is if you want to practice in India, you have to give next exam, which is the last clause which they have put. It clearly states that people who have done their medical education from abroad, and if they want to come back to India to practice, they have to give FMG, Foreign Medical Graduate Entrance Exam, till next का becomes operational. So जब तक next नहीं आता है तब तक आपको FMG पेपर ही देना होगा. बट जिस साल से भी नेक्स्ट इम्प्लीमेंट हो गया उसके बाद आपको FMG नहीं देना है, आपको नेक्स्ट ही देना है. नाउ हियर कम्स द मेजर एरिया ऑफ कंटेंशन. What they have done is they have said that next would be in 2 steps. It was always decided that next 2 part में होगा, next step 1 and next step 2. This is common for everyone. It's not something which is just new for FMG graduates. It's for Indian students also. So Indian graduates as well as FMG students ही next 1 and next 2 दोनों देंगे. But यहाँ पे underlining question जो आया है वो ये है, FMG candidates को next 1 पेपर के साथ साथ उनको प्री एंड पैरा क्लिनिकल का एक एक्स्ट्रा पेपर देना पड़ेगा. सो दैट इज अ बिग कंटेंशन ओवर हियर, क्योंकि अब बहुत सिंपल है. आपके स्टेप 1 में ऑलरेडी बेसिक साइंसेस का 10% आ ही रहा है, कम्युनिटी मेडिसिन का 10% आ ही रहा है, डायरेक्ट वेटेज क्वेश्चन. सो वापस से प्री एंड पैरा क्लिनिकल का सब्जेक्ट लेना doesn't make sense. So you guys can put this forth that already the 10% of the question are in community medicine and pre and para clinical. So there's no point of conducting a separate paper for FMG candidates. पहला चीज. दूसरा कंटेंशन ये है where they have mentioned that FMG graduates को 2 साल के अंदर ही अपना पेपर क्लियर करना पड़ेगा so that they are able to register themselves in India. So guys, ये सबसे मेजर प्रॉब्लम है. सपोज आप इस साल पास आउट हो रहे हो ईयर 2021 में, so आपके पास एग्जैक्टली 2 साल है, मतलब by 2023 आपको नेक्स्ट पेपर क्लियर करना होगा. अगर आप नहीं करोगे तो आपकी डिग्री का कोई वैल्यू नहीं रहेगा. मतलब all your hard works which you have put in, your whole 5 years or 6 years of your education will go on to a waste. You will not be able to use DR, doctor, in front of your name. So this one is the major point of a contention for a lot of FMG graduates. Now, coming to the question of whether transfer is allowed or the number of attempts and all, guys, number of attempts के लिए already screening test regulation 2002 में एक verdict already pass हो गई थी जब MCI थी, जिसमें clearly बोला गया है, which was passed I think in 2003, amendment हुआ था जिसमें clearly ये बात बोला गया था there would be no limit for the FMG graduates to qualify. राइट. सो ये ऑलरेडी सुप्रीम कोर्ट में केस भी चला था, हाई कोर्ट में शायद केस चला था, एंड उसके बाद ये स्क्रीनिंग टेस्ट में ही रेगुलेशन आया था. सो आप उस पॉइंट को भी यहाँ ला सकते हो NMC से जब आप बात कर रहे हो. इसके साथ साथ जो हमारी जो ट्रांसफर की बात है, whether transfer is allowed or not, ये सारी चीजें ऑलरेडी हाई कोर्ट में पास हो चुकी हैं. सो ट्रांसफर ऑफ कैंडिडेट्स फ्रॉम वन यूनिवर्सिटी टू different university has always been there. मुझे अभी भी नहीं लगता और हमारी टीम को अभी भी नहीं लगता है कि यह आपके लिए है. So I would request you to get a clarification in the same aspect from the NMC, because उन्होंने बोला है कि आप इसमें अपने ओपिनियंस दीजिए एंड फिर बाद में फाइनल अमेंडमेंट होगा एंड ये ऑर्डिनेंस बनेगा एंड देन ये पास आउट होगा. सो डेफिनेटली आप अपना पॉइंट ऑफ व्यू बोल सकते हैं. मेजर प्रॉब्लम जो आपके नेक्स्ट के साथ है वो यही है कि आपके साथ जो एडिशनल पेपर देना पड़ रहा है वो विच इज प्री एंड पैरा क्लिनिकल, एंड द लास्ट वन विच इज आपको 2 साल के अंदर उसको पास करना है, द ईयर ऑन विच यू पास आउट. So this is a very basic way I try to explain you guys what exactly is written in the NMC draft. So kindly go through it properly, and for if you have any doubt, any query regarding the same, you can always get in touch with us at 011-450-81755. And also guys, if you want to know about what exactly is next and all, the video has already been shared on our Gyanshetra YouTube channel. You can always go there and find out what exactly is next and what all subjects would be included over there. All the best, stay safe, take care, bye bye.